To talk about why it's so important to know your risk for heart disease, please welcome cardiologist Dr. John Kennedy and his patient Nancy to the show.
Welcome.
And I'm really glad, Nancy, that you're on the show because I think you are a classic example of a woman who looks healthy, looks great, but the risk factors when it comes to heart disease are largely silent. So you did the right things. When you see someone like Nancy, what kind of testing are you doing and why?
What I can do and what cardiologists can do to help you determine what your risk is of having a heart attack in the future are some safe, non-invasive studies like a carotid intimal medial thickness test. And that measures the plaque inside the artery very early on. The carotid intimal medial test is great for women, Travis, because you limit radiation exposure and you get a lot of information about the disease early on. There are other tests like a coronary calcium scan you've heard a lot about in the news. Those are great for a little bit older patient, maybe in your 50s. Definitely not in a woman that's of childbearing age and
someone higher risk because there is radiation exposure.
That's exactly right. And if you identify it early, you can make a huge impact and a preemptive strike on preventing it from ever happening in the future. Another simple test is a cholesterol test, like we showed early on.
And what I love about this is a quick afternoon at the office. There's not a lot that goes on here. There's the ultrasound, quick blood test. Are you anxious to know your results?
Very.
Dr. Kennedy?
So I'm happy to tell you your risk of a cardiovascular event in the next 10 years is less than 1%.
Yeah.
So you've done really, really well.
Thank you.
It's awesome.
It's all about knowing your risk. And doesn't it make you feel better?
Yes, much better.
Thank you for sharing your story, Dr.
Thank
Kennedy.
you.
Thank you.
Hey, thanks a lot, guys.